Good afternoon, everyone. To bring you up to date, today we reported an additional 206 Tulsa County residents who tested positive for COVID-19. Cumulative total of 4,571 cases here in Tulsa County. The good news about that is that we've got 3,451 people who have recovered. There are currently over 1,000 confirmed active cases of COVID-19 in Tulsa County. Unfortunately, today we are reporting an additional death in a male over the age of 65, bringing our total to 72 lives lost to COVID in Tulsa County. And please, as we always say, keep those families in your prayers. As I run through the latest data, please remember that this is for last week, which does not include the high numbers reported this week. For the week of June 28th through July 4th, overall we saw a decrease in new cases compared to the previous week. From the previous week, we saw a 22% decline. The average age of new cases declined again down to 35 years of age. Again, the age group 18 to 35 makes up the largest group of new cases, representing over 46% of new cases. Age 36 to 49 is the second largest group to have new cases, representing 22% of all cases. 50% of hospitalizations are in people who are under 50 years old. Those aged 36 to 49 represent 25% of all hospitalizations. And as we've been talking about before, the Tulsa Health Department epidemiologists and contact tracers continue to investigate all confirmed COVID-19 cases amongst Tulsa County residents. Always want to point people in this direction, but there's a wealth of guidance available to businesses on the CDC website and on the Tulsa Health Department website. We encourage all businesses to review their own plans to ensure the safety of employees and customers you serve and adapt as needed. The Tulsa Health Department continues to provide recommendations to local public and private schools, universities, local events and venues, restaurants, community organizations, and faith groups as requested. And last week, as you recall, a collaboration was announced between the City of Tulsa and Tulsa Health Department to support organizations in the Tulsa Metro and event organizers to make safe decisions when developing best practice for their use. As to go over it again, Tulsa Health Department will review and provide recommendations on safety plans submitted to us, but just remember that any guidance or feedback provided will be advisory in nature. THC does not regulate, approve, certify, or otherwise make guarantees about the effectiveness of your plan, but we will give you a recommendation that hopefully will help your plan be effective. Our review is intended to assist you in implementing those CDC recommendations that are a part of your plan. We know gatherings of any size can be conduits of transmission, so if you are planning a special event, we encourage you to review the guidance available on the CDC website and on the Tulsa Health Department website. THC will also be evaluating safety plans for large events over 500 people in Tulsa, so our public health professionals can work with event organizers on a case-by-case basis in making safe decisions as it relates to those events. If a business would like a consultation or you need to submit your event safety plans, please call Tulsa Health Department at 918-582-9335 or email to covid19plans@tulsa-health.org. Let's talk about masks. I know that's probably what everybody's waiting to talk about. I am strongly encouraging that all residents wear a mask or a cloth covering across your mouth and nose when you are in an indoor public place and less than 6 feet away from people not of your household or your family. We respect Tulsa County businesses for being forthcoming and taking action to protect their employees and patrons for making masks mandatory. All businesses can refuse entry and service to customers not wearing masks. We strongly recommend businesses requiring close customer-employee interaction to refuse service to customers who do not wear masks. Anytime you are around people who don't live in your home, you need to wear a face covering. If you are hosting guests in your home, even for a backyard cookout, you need to wear a face covering and ask all guests to wear one as well. This is the new normal. We have to start embracing our new normal. Throughout history, our country and our community has come together in face of adversity. We have cleaned up after tornadoes, we have donated blood, we have rationed our food supplies in wartime. Oklahomans know how to come together to respond to significant challenges and events. So based on that, and how Oklahoma conducts themselves, how Tulsans conduct themselves, I'm asking everyone today to wear a face covering, come together as a community, as we have done in the past, to protect each other and slowing the spread. As we said last week, we started to see a slight decline in trends, but this week that's changed. So we are closely monitoring the data and following those trends. If we continue to see an exponential rise in cases, which frankly we expect over the next few days, I will be asking our local mayors and city councils to make face coverings mandatory. Give us a couple more days to make sure that the trends are going in the direction that we think they're going. So as we talk about face coverings, here's how to wear your face covering correctly. Wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. It should cover your nose and your mouth, not just your mouth. Try to fit it snugly against the sides of your face. Make sure you can breathe easily. Take off your face covering carefully when you're home. Untie the strings behind your head or stretch the ear loops. Handle only by the ear loops or ties. Fold outside corners together. Place covering in the washing machine. Be careful not to touch your eyes, nose, and mouth when removing it, and wash your hands immediately after removing your face covering. Cloth face covering should not be worn by children younger than 2, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the cloth face coverings without assistance. Public health officials recognize that wearing cloth face coverings may not be possible in every situation or for all people. In some situations, wearing a cloth face covering may exacerbate a physical or mental health condition, lead to a medical emergency, or introduce significant safety concerns. Adaptations and alternatives should be considered whenever possible to increase the feasibility of wearing a cloth face covering or to reduce the risk of COVID-19 spreading if it's not possible to wear one. We appreciate everyone who practiced enhanced health and safety precautions over the holiday weekend. We understand many people might have gathered in large groups, so we encourage Tulsa County residents who chose to go to any setting where people were in close contact with one another to take precautions such as wearing a mask, practicing social distancing, and frequently washing their hands. Excuse me. Those who have attended a large indoor or outdoor gathering should monitor themselves for symptoms for 14 days after the event and seek testing. You should also continue to monitor symptoms, social distance, wash hands, and wear a face mask and face covering in public. The Tulsa Health Department is one of many sites in Tulsa County to offer COVID-19 testing. All local healthcare systems offer testing. There are additional sites listed on our website. If you have been tested because you are concerned you have been exposed to COVID or you are not feeling well, please stay home until you receive your test results. As a public health agency, our charge is to provide the guidance and recommendations to keep our community safe. We appreciate everybody listening. We appreciate input. If we need to change our messaging so it connects better, please let us know, and we will do that. We want to do whatever it takes to get Tulsans to understand our new normal. Thank you very much. I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. First, before I begin on the COVID, I just want to thank everyone who in the last week in this community has shown so much support for the men and women of the Tulsa Police Department and the families of Sergeant Johnson and Officer Zarkashan. The fundraiser that's going on today at a number of sites around the city, with the main site being out at La Fortune Park, benefiting the Tulsa Police Foundation. 100% of the proceeds going to these two families has just been tremendous to see that turnout. I was out there at 7 o'clock this morning, and there was a line of cars trying to get into that parking lot to make contributions. And I heard that the foundation raised over $100,000 in the first 4 hours. And that's not with individuals coming in and making giant contributions. That's small bills and cash that people are coming through and putting in a can to support these officers and their families. So from the bottom of my heart as the mayor, I just want to say thank you to everybody in Tulsa who's showing so much support in such a tragic time. On the subject of this press briefing, you just heard Dr. Dart talking about the data around COVID's positive case numbers here in our community and his desire to to look at those trends over a few more days and see how those play out. I think it's important for me to explain where we're coming from the city government standpoint in Tulsa, from a regulatory standpoint, because I've had a lot of folks step up and send me emails or on social media or approaching me out in the community saying, you need to make everyone wear a mask. And I don't know of any public health professional that I've talked with or a health professional, a doctor, a hospital leader who doesn't believe people should be wearing masks. The challenge for us from a city government standpoint on this, and the reason that we don't just run out and do it, is that if you put an order in, you have to enforce it. It's not just a helpful suggestion if you're putting in a mandate. And regulating that would be a tremendous responsibility for our local law enforcement agencies. You think about what we went through in the early going of this pandemic, where we shut down bars and had restaurants shifting over to carry out only. Well, in that universe of companies, you might be talking about maybe a couple thousand at most that the police are having to check on and follow up on leads on. When you talk about when we did our overall safer at home approach, or when the governor put his order in, but he exempted so many businesses as essential businesses, still, you're talking about maybe several thousand entities in our metro area that had to be tracked and monitored. With an order like this, you're talking about 1 million people in a metro area that may not even live in Tulsa but work in Tulsa, that come through here, that have to be monitored and followed up on. And so that, when I talk with our hospital leadership, when I talk with Dr. Dart, I think the concern that I've heard is not that people think, oh no, people don't need to be wearing masks yet. I haven't heard anybody say that. It's that we need to make sure that if we are going to put that kind of a massive responsibility on local law enforcement, then we need to be at a point where we have no other choice than to do that. On that note, we've talked a lot throughout our reopening plan about different data metrics that we're tracking. In the early going, we talked a lot about positive case rates. The state's primary metric that it's used throughout the reopening process has been hospitalizations. The good news is that our overall hospital capacity in Tulsa remains strong. But I will tell you, I check in routinely with the leaders of our hospitals here in Tulsa, and throughout the reopening process, what I've heard in nearly all of those is, Mayor, we have capacity, we're doing fine, things are fine. It was this week that I finally started to hear some concern, not about where things stand today, but where things could look if we continue on this trajectory unchecked. And so that's where I think the importance of the Tulsa Health Department's data analysis and looking at those trends, and what Dr. Dart was talking about just a moment ago, about giving him a few more days to look at what they think, if the overall trend data looks like it's going to continue on the trajectory that they think it will, then he will recommend that we have that kind of mask order. To that end, we want to be prepared as a city if and when Dr. Dart gives us that recommendation. This is not a simple one-liner order that says everybody wears masks. There are a lot of factors that go into that. What age people should be, if they have to be wearing them. What exemptions are there? Should they only be wearing them indoors or outdoors? What professions are people exempted from? What medical conditions could people have that would exempt them from wearing them? Are you regulating individuals or businesses? These are all things that when you look at these orders that have been put in place in states around the country, and by and large, by the way, these are usually state-driven, not cities having to do it on their own. Those cities have supplemented them, probably most notably in Oklahoma would be Norman last night. But there's a lot of factors that we want to make sure that if we're going to do it in Tulsa, that we're adopting best practices from around the country. And so our legal team at the City of Tulsa right now is working with the legal team at the Tulsa Health Department in evaluating what different orders around the country at a local level look like, and if we need to move forward with one here in Tulsa, what would be that best practice. So all of that to say, the reason we haven't done it yet to date is because we have not been told that there is just no other option and we have to do it. But we will be prepared if and when we're told that. And as always, throughout this event, the primary thing for us is protecting the integrity of our local healthcare system to be able to treat those most in need. All that being said, it shouldn't come down to us having to do an order. If you think about the tensions that we've had throughout this pandemic, there's been one big tension back and forth, and it's between public health and our local economy. For the first 2 months of the pandemic, we pretty much openly acknowledged that we were going to have to really damage our local economy to be able to maintain public health and the integrity of our local healthcare system. And Tulsans stepped up and made those sacrifices in historic ways to protect our neighbors. Then we began the reopening process. And in order to allow our economy to re-engage, we did things that we knew were going to be more risky than just staying at home. That's when people started going back to work. That's when people started going back to restaurants. Throughout this, you've had that tension back and forth between public health and the economy. When it comes to wearing a mask, this is one of those things where it benefits both. Because if people don't wear masks and this virus continues to spread, then we will be faced with a situation where we have to again talk about rolling back the reopening measures that have gone in place, and that will unquestionably hurt our local economy. But if people wear masks and prevent that spread, you're not only helping the health of your neighbors, you're also making a contribution to helping our local economy by avoiding that scenario. So I would ask all Tulsans, don't wait for Dr. Dart to say that we have no other option and ask local governments to put in an order and then put that tremendous responsibility on local law enforcement. Step up and do it yourselves. We can all do something so simple. Just putting on a mask when we're in public or when we're in our office or when we're around folks from outside our household and there's not the ability to socially distance. And we can make a positive contribution to local health of our neighbors, of our friends and family, and we benefit our local economy's ability to recover. This is one thing we can do that benefits everything. So, on that note, I do want to thank all of the restaurants and bars who have complied with the order that I put in place last week, requiring their employees to wear masks when at work. I will tell you, probably one of the things I've appreciated the most is the number of restaurant owners who've reached out to me and said, thank you for putting that in place. We had a ton of restaurant owners and operators who were already doing the right thing, but they didn't want to see their industry dragged down into further regulation because of bad actors who weren't doing it of their own initiative. So I'm thankful for the restaurant and bar owners who were doing the right thing to begin with. I'm thankful for the restaurant and bar owners who are all doing the right thing now. And this, again, based on the data that we're seeing from the health department, has been one of our hot spots. And so we put this order in place driven by that data that was pointing towards this as a particularly risky activity. I had a couple folks ask if coffee shops count within this order, and they do. And so you should consider that as well if you're going to or work at a coffee shop. I'm very thankful for the number of businesses that and churches who have proactively reached out to the health department since we announced the safety plan certification program last week. I think that is a great example of us having local operators, whether they're business owners or faith-based institutions that want to do the right thing but want to talk with the experts on the best way to go about that. And we've had, I think, a really good response in that first week. We've had over 50 already submit safety plans to the Tulsa Health Department for their review and consideration. Again, if you have a business or you have a church and you want to run a safety plan by them so that you can make sure that you're providing safety for your employees and your customers, you can send them to COVID-19 plans at tulsahealth.org. And all of that will be on the City of Tulsa's website afterwards, and it's already on the Tulsa Health Department's website. Under our new order, just a reminder that a week from tomorrow, any event that is occurring on or after a week from tomorrow will need, any event that's over 500 people will need to have a safety plan approved by the Tulsa Health Department. I've already had several groups that have reached out to them to run those plans by them. I think this is another one of those things that as we start to modify towards the long haul of this pandemic, this is a common sense practice that we can put in place. And I really appreciate, I've heard from hotel owners who have events that they want to host, religious institutions have events they want to host, and they are reaching out proactively to get those run by the Tulsa Health Department before those events take place. Now, with an update from the Tulsa Fire Department, I'd like to introduce Chief Michael Baker.
Good afternoon. A few weeks ago, I was at this very podium and discussed the closure of Fire Station 24 related to a group of shift that had been exposed to a member who had a positive test result. I wanted to come back and update you on the status of the Tulsa Fire Department and our ability to protect the community effectively. So we are not immune from the effects of this increased cases in the city. And I can echo what Mayor Bynum and Dr. Dart have said, that we are seeing some of our younger members that are coming back positive. Currently, we have 68 members of the department that are under a quarantine status. And not all of those are showing symptoms. We have, we're a social profession, so we do shift change. We live together in basically 30 neighborhood houses across the city. And so we're a very high contact population of workers. So sometimes our family members expose us, members develop symptoms while at work. But that group of 68 have been tested. We have 17 that have come back with a positive test. We have some members that showed some symptoms, not everything. No one has been hospitalized. And fortunately, with good staffing numbers, we're able to have a complete backfill of staffing, so no stations are closed and no operations are being impacted. As for the department's response to this increase, we have really changed a lot of our internal business practices. We're doing our own testing. So we are working with the City Medical Division to complete tests on our members by our staff of medical personnel. We are clearing members back to duty in a collaborative manner with, once again, our city physician, Dr. Berry. We're doing a open air drive-through clearance so we can get folks back to work as quickly as possible. Last but not least, we have a medical unit that is monitoring and doing contact tracing, is increasing their education on that process as well, and we're really refining processes about the shift change. Firefighters are no longer going into the station, sitting around a common table and having coffee at shift change. They're shift changing one at a time in the parking lot as they pass. So we've really adapted our programs and processes to comply. We're also limiting exposure in public visits, like if we go to the grocery store, we're wearing masks and limiting the number of folks going there. One of the things that you'll notice about our exposures are, unless we have some information we're not aware of, none of these exposures are coming from a patient with a known COVID positive or showing symptoms on an emergency response. This clearly indicates that our personal protective equipment, including masks, is working to protect your firefighters. We are a critical community resource that has to be in place, and we need healthy members. We also move from home to home, and it's important that we are healthy when we come to your house for a medical emergency or fire response. So once again, The masks are working within the Tulsa Fire Department. We're not being exposed even when we're alerted to someone with COVID symptoms. So I also want to take a moment as we approach a weekend event with heat index probably about 109 forecasted to talk a little bit about heat illness and heat emergencies. We work in a hot environment. That sounds like a common thing, right? Yes, we do. We are firefighters. But heat plays an especially hard role on the physical conditioning and the physical environment that a firefighter works in. So we're very good at monitoring heat and heat illness and treating our firefighters. So there's a few things that I want to make sure that you understand is pre-hydration helps dehydration. So if you are planning on an outside event, you're going to do work in the yard, or you have a project that you need to do and you're going to be forced into the heat environment, please make sure you pre-hydrate. Don't try to catch up on your water consumption once you're already hot. You cannot consume enough water to let your body process that. Nausea and vomiting are early signs of heat illness. And so if you start feeling a little bit sick to your stomach or have muscle cramps in the large muscles of your body, make sure you get into a cool environment immediately and rehydrate. Heat is really not something to be taken lightly. It is a significant medical emergency if you extend yourself beyond your capability of your body to heal. And so my point is that pre-hydrate, stay in the shade if you can, stay indoors if possible, and be heat aware as we work into this weekend where we know that the heat, you have plenty of time to prepare and plenty of time to change your plan and adjust as we go into the weekend. Thank you very much.
Now we'll open it up for questions, and we'll start with Dr. Dart.
So I did that.
When we talk about, an ounce of prevention is worth a pound of cure, would it be better to go ahead and just start with the mask mandate and then work on the enforcement as we go along, as opposed to kind of a wait and see approach?
Thank you. And the question was, would it be better to go ahead with the mandate as we try and figure out the enforcement approach? And this is really a critical thing. It's a brand new thing, and I think if we do it without having all of our ducks in a row around how we're going to ensure that people can continue to do it, it might end in total failure. So if we're going to do this, it's important that we do it the right way. We have all the legislation and language correct so that it can be hopefully seamless and run smoothly from the get-go instead of having a series of stops and starts.
When you say 2 days, are we going to be back here on Friday? Is that as much time? Is that how much time you need, or Monday?
And that's so is really a few days the right connotation or the right metric to look at. And yes, I think so that we need to give at least a couple more days to really see if the trend's going where we think it's going. And so far, we've had 500 cases, almost 500 cases in the last 2 days. So if that continues over the next couple of days, it's our decision we've made for us.
Dr. Dart, what's the exact metric that you're looking at for when you're going to pull the trigger, or if you pull the trigger on a mask mandate recommendation?
So the question was, what's the exact metric? And there's more than one, and the mayor mentioned it. We look at what we've been looking at really all through this whole response. Our hospitalizations, our percent of daily positives, our case counts, and then our 4 and 7 day rolling trend. So we look at all that, because it should be comprehensive. It shouldn't be based on just one metric, and because all those metrics contribute to the issues we're concerned about with overwhelming the healthcare system or public health system. So,
is there an equation that's based on those metrics, or is it kind of a gut feel?
no, the metric itself are mathematical formulas. So it's a metric, it's data, and data tells us really what we should do. And the bottom line is that we've got to, I think, change the conversation, because everybody wants the best outcome for everybody here in Tulsa and Tulsa County. And something simple as wearing just a little piece of cloth over your face is not that hard to ensure that you stay safe, your neighbors stay safe, and your family stays safe.
What are some complications that recovered patients have been facing today?
So the question is, what are some of the complications that recovered have been facing? And for the most part, we've had a pretty clear recovery. But as I said earlier, 2 days ago I talked to a marathon runner who can't run right now, and someone in that 35-year-old age group. So the complications have really been around lethargy and respiratory issues and lung capacity issues.
We've seen
It's Tulsa County the worst in the state in terms of cases, I'm assuming you're asking. So, yes, right now we do have the highest number of cases. And, we've had some significant events in the past few weeks that more than likely contributed to that. But really, the major thing is that, as the mayor talked about, we all want to open up, we all want to engage, but we have to follow different rules now. We all live our life under different sets of rules, and everyone chooses what those are. Well, right now, we have to make the same choice. And if we're going out in public and we're engaging with other people and we're not taking precautions, we're going to have transmission. I mean, that's just the bottom line. And it's going to continue. And we have to make that stop. And if we can't get people to voluntarily do what's best for them, do what's best for their family, do what's best for their neighborhood and their community, then that's when government steps in. And not that we want to, but we have to keep people safe. We have to break the chain of transmission.
What's Tulsa seeing so far this week regarding the Trump rally and contact tracing? Are we starting to see that now or not yet?
Well, I said we've had question was about, are we starting to see things connected to the Trump rally or the other protests? And so, as I said, past 2 days we've had almost 500 cases. So, and we knew we had several large events a little over 2 weeks ago, which is about right. So I guess we just connect the dots.
So going to the safety certification program, the mayor mentioned that there's been already more than 50 individuals submit plans for certification. How long might it take to review these and get a certification or a recommendation to make some alterations before certifying?
So the question was, what's the time lag in submitting a safety plan and getting a response back? And we asked to get the plan at least 2 weeks before the event to give us some time. And so far, we've met a lot with our staff. Our staff have been amazing and have really stepped up and created some wonderful guidance and templates so that we can do the review somewhat seamlessly and a little more efficiently. So we expect at least a week, minimum week turnaround.
Dr. Dart, last question.
Dr. Dart, you said you're, Tulsa well in your view that you really want to see college football this year. How are you feeling about that?
The question was asked if I want to see college football this year. Absolutely, I want to see college football this year. We're talking about it before this started, but if it's going to happen, number one, people have to wear masks now. That's just the bottom. Otherwise, we'll have so much disease transmission, no one's going to be able to come together. But if it also does happen, we're going to have to still follow recommendations around mask and distancing and hygiene in order for it to take place. So if it does take place, it's going to look differently if that stadium wants to be safe and not a conduit for transmission. But if we don't stop transmission now, there's a good point that a lot of things in the fall either won't happen or will look extremely different.
Okay, and I'll take questions from Mayor Bynum.
Mayor, do you know who put the mask on the Golden Driller?
I don't. I just saw that on social media. I don't know who did that.
I didn't know if you were either.
No, that's the Golden Driller belongs to Tulsa County. So, wish Commissioner Keith was here. She could tell you.
Mayor, you mentioned that.
When you're talking about, obviously, you touched on how difficult it would be to enforce the mask mandate, but kind of it sounds like it's like you're building a snowball, right? And it's getting worse and worse, and you have to stop doing it. What's the city got to lose by just saying, hey, you know what, let's just mandate the masks?
I think the question is, what does the city have to lose by not just mandating masks right now? And I think that the thing that citizens need to understand is that when we put that kind of mandate in place, we will be putting it there because we had no other choice but to do that to protect their ability to get medical care over the long term of this pandemic. And in my mind, when I go around town and see so many people not wearing masks, I think that's the only way that we can convince people by putting a mask mandate in that they need to take it seriously and not just put all that responsibility on the local law enforcement to be issuing citations that can lead, if people don't pay it, to being incarcerated, all of which goes against so much of what we've been talking about wanting to do locally over the last couple of years. We don't want to have fines and fees on people for not wearing a mask lead to them being incarcerated. So that's the main reservation for me, I want Dr. Dart and our health department and the leaders of our hospitals to be able to look at the citizens of Tulsa as we did when we had to close down things before and say, we're doing this because this is the only option to protect your ability to get medical care.
Understanding that it's not been implemented yet, but what might enforcement of this look like? Are fines and fees on the table right now? You know, what are we looking at to actually be able to enforce it should this happen?
Well, I mean, we're looking at the ways a number of different cities and states have done that. I mean, a good like neighboring example would be like state of Texas. They have one that Governor Abbott put in place that gives people a warning for their first time, and then after that a fine. I can't remember in that particular instance how much the fine is, but it says that you can't be incarcerated right off the bat for not complying with it, but each time that you're caught violating it, you could be fined. And in most of the cities that we've looked at, they have similar language, that the goal here is, one, if you'll recall, in the early going of the pandemic, when the Tulsa Police Department would get a report of a restaurant or a bar that wasn't complying with our orders, they wouldn't immediately go out and arrest everybody and put them in jail. They'd go out and make sure that, and working with the health department staff, make sure that they were aware of the order in place. And by and large, most of the entities that they reached out to complied after that warning. And so most of the cities we've looked at and states we've looked at have a similar kind of approach of an initial warning, but a fine after that. And the incarceration issue does not come up with most cities on, well, you're not wearing a mask, we're taking you to jail. It's, you're not wearing a mask, you were fined, and you didn't ever pay it, and that's what leads to incarceration, which is a much larger issue that we're trying to work, and I know the City Council has been very focused on addressing and trying to find ways that we avoid those types of situations where nonviolent offenders end up in jail.
Harry, you mentioned that
I'll come back to you in just a second.
you mentioned that the mask mandate is like the last option. What are the options between now and that mask mandate?
Well, yeah, so the question was, you know, with the mask mandate as the last option, are there things between here and there? Well, first of all, the mask mandate is not the last option. The last option is to start rolling back and ultimately going back to shelter in place like we were a few months ago. But the mask is the interim measure. And the issue for us, I think, to get public buy-in and for people to truly take this seriously and understand why they need to do it, is to know that that order isn't being put in just because we think it would be a good idea. We're doing it because we felt like we had no other option to protect the integrity of our healthcare system and the trajectory that we're on other than to put this kind of order or ordinance in place.
Do you get worried that people are going to start calling 911 on folks who aren't wearing masks?
I mean, we ran into that. The question is, do I worry about 911, being inundated with calls about people not wearing masks? I mean, that is characteristic of the overall concern that I have if we haven't developed larger public buy-in in the need to wear masks, is that all of a sudden you're putting all of that responsibility not on individuals in the community, you're putting it on local law enforcement to enforce something that may not have broad community consensus and support. And that presents a tremendous enforcement challenge. And so, we've tried to talk for months about why it's such a great idea, and that has not worked. I think the people who are going to be responsible and do it of their own volition because it's a good idea are already doing it. Now we're getting at a point where our hospitals are getting concerned that the trajectory we're on is not sustainable. And that, I hope, changes the thought process in some folks' minds in our community about where we're headed if they don't just start wearing them voluntarily. You could get to that point where you have to have that kind of order in place. And if the trajectory, at that point it's not sustainable, then we do have to start talking about rolling things back. And think about the impact that had on our local economy earlier this year when we had those rollbacks. We can avoid that with simple things. This is not the Great Depression where we're asking people to, get together and move out to California because it's the Dust Bowl. We're asking you to put a cloth over your face when you're in an inside area around other people, or if you're outdoors and can't socially distance, to wash your hands and to practice social distancing. These are not historic challenges for people. So let's not treat them like they are. Let's just wear a mask that benefits everyone else's health and benefits our local economy and avoids the much more damaging scenario, which we've already, all of us in this community have been through earlier this year. Let's avoid having to go through that again. And there's 3 super simple things that people can do to avoid that.
Last question.
Mayor Bynum, is there, so your order for bar and restaurant employees to wear masks, was there data that showed that that was the bigger danger of them giving guests potential infection? Because the messaging has been so far, your mask protects others.
Yes. So that's a great question. The order on bars and restaurants and their employees and asking, mandating that they wear them came out of discussions that I was having with the Tulsa Health Department around their contact tracing that was showing them what the leading causes and contributors were to cases in Tulsa. That's what also informed our order on events of 500 or more. Less, I think, because of, at that point, that I know everyone likes to talk about the rally, but we have a lot of other large events that occur here, religious events, weddings, funerals, and all of those are also in that Serious 7 that we've put out there for people to see. But that specific order came at the request of the Tulsa Health Department that we put it in place and that they be able to monitor the impact that it would have utilizing their contact tracing. And if they see that it's not making an impact, then we would look at repealing that. That's what Dr. Darp told me last week when we talked that through.
Do we have any questions for Chief Baker?
Thank you.